Good afternoon, everyone. My name is Bassam Haddad, and this is the 31st teach-in at the Gaza and Context Collaborative Project and teach-in series. This teach-in is titled Mortality Estimation in Gaza Between Politics and Reality, and we are extremely fortunate to have with us Zeina Jamaluddine, whom I'll introduce in just a moment. This 31st teach-in is co-sponsored, as usual, by the Gaza and Context Project, which includes 24 universities and research centers. We have been at it from the get-go from October 2023, weekly providing teach-ins as well as various podcasts, conversations, and a host of other resources. We are also happy that today we are addressing something a little different than what we usually address, and there's been a lot of interest in it. It's about all of the talk about numbers. Whereas there isn't a huge puzzle as to what is going on in terms of the basic numbers, there is actually quite a few different approaches, and we have with us an epidemiologist who is here to clear things for us. Zena, before I introduce you, I want to ask you, Kifik, how are you?
Alhamdulillah, like everything with the past month has been really bad, but we are working to show the numbers and trying to reach out more voices to what's happening in the reality in Gaza. So yeah, how are you?
Thank you. على فكرة, this is the first time somebody asked me in return how I actually don't know, but I think I'm okay. Shukran. Thank you. Let me just say a couple words about. I think what happened is. Ooh, no, no, don't do that. Don't do that. No, 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 don't do that. The the camera saw me do something with my hand, and it actually responded to my gestures. Not good. Not good. That's what happened. Okay, we go back to reality. Let me say a few words about Zaina before I give her the floor. Zaina Jamaluddine is a nutritionist and epidemiologist at the London School of Hygiene and Tropical Medicine. Her work focuses on improving the health of women and children affected by conflict in the Middle East and North Africa. Her research includes validating tools for assessing insecurities, quantifying health and nutrition inequalities, and evaluating assistance interventions. During the Gaza war, Jamaluddin co authored an analysis examining excess mortality in Gaza during the early stages of the war using data from the Palestinian Ministry of Health. She also led a research project developing scenario based projections of excess deaths in Gaza, which aim to quantify the potential and direct health impacts of the ongoing crisis. These included projections related to infectious disease mortality, maternal and newborn mortality, non communicable disease mortality, and increased acute malnutrition. With us today is Professor Zaina Jamaluddin, or Dr. Zaina Jamaluddin, and we are very, very excited to have her address this topic. Zaina, I'm assuming you'll be speaking for a few minutes before we get into questions, and I know you have some slides and with numbers and the analysis and the articles that you've written. Many of us have seen them already, but we would love to hear your take. So the floor is yours.
Thank you, Bassam, and thank you for the introduction. So I will start from the very beginning of the war so that we understand what happened with mortality and counting and estimations. So just even before the war, Gaza had a very good system of electronic system of counting mortality. They have been tracking mortality from COVID-19, different diseases. And this is the same system they've used in different wars. And it relies on hospitals reporting the mortality of a person. And so at the beginning of the war, the ministry was using the same system that they've been using from people who were coming to the morgue with including information of the name of the person coming and when they died and different information related to individuals who were killed. And so at the very onset of the war, there was a lot of questioning of the mortality. and including the President of the United States, who said that he does not believe the number being reported. And the ministry decided to then release a report showing name by name the names of people who were killed. I think everyone have seen maybe these names that circulated. What happened is, in fact, that in November, with the attack on a Shifa hospital, which was actually the main information center for the Ministry of Health, the reporting became harder. So, of course, if you're attacking the healthcare hospitals, where the main information center for gathering all the data, the reporting becomes more and more inaccurate. And so, what the ministry then moved its headquarters to Nasser Hospital, and it's the same scenario that happened in Nasser after. And so what we're seeing now is the fact that the Ministry of Health has still used these listings of all the names of people they get from more, but they also had to rely on different methods to get names of people who are killed. And this list that the ministry releases, or the numbers that we're seeing of 40,000, only include actually people who were killed from traumatic injuries or people who were killed due to the war. So all the numbers of people who were killed because of lack of access to care, for example, if a person has a heart attack, they need to go to the hospital. They don't have access to the hospital because of the attack by Israel on the hospitals, or because of lack of access and different things related to the war, lack of access to medication. All of these mortalities are not documented. And that's where a lot of the questioning happened about, okay, so the healthcare system is being attacked and collapsed. The supply of vaccine has decreased, and children are less vaccinated. Where in fact, before the war in Gaza, 100% of the kids had vaccine. Now, this has decreased, and then at the same time, the healthcare workers are being killed and or abducted. And so, this whole situation, as public health practitioners, we know that would lead to excess mortalities from uh, other causes of death, including chronic diseases, so heart attacks, diabetes. At the same time, also mortality from maternal health. So a mom or a pregnant woman is not able to deliver in a hospital to get the care she needs. If there's an emergency operation that needs to be done, it's not being done. There is no blood. So all of that started to come up back in December, actually. And this is where we started to do the projections to try to understand, um, really what would be the mortality from these different causes. And this is where basically the projections that we've come up with. Also, we released them back in February, and back in February we started to raise the alarms on how the situation in Gaza would lead to excess mortality, not only from trauma, but also from the indirect effect of the war. And finally, to say that these are projections, but in fact, it's very hard today to come and say we want to do studies and to really understand the really indirect effect of the war in terms of number. Partly because I can explain more in detail at the very end, but in fact, it is an issue of access. It's an issue of ethics. So do you call people and ask them these questions while you're not able to provide them with services? So all of these questions come together in all conflicts about how do we estimate mortality. And the fact that we already know what the mortality is really based on the fact that the Ministry of Health in Gaza has put so much effort to keep tracking them. So I hope this was a good introduction to the whole
Absolutely.
topic.
Absolutely. Actually, I know that you wanted to leave this until the end, but can you start with actually addressing the question of access? Because it is unfortunate that people sometimes, especially when they hear the word Hamas, automatically they start doubting things, which is based on the record, not just today, but for the past 20 years or 19 years or 18 years since 2007, 17. The actual record demonstrates that the numbers that have been shared by the Ministry of Health in Gaza, that is actually, under Hamas's governance, it's not run by Hamas operatives, have actually been not just accurate, but have been the ones that Israel ultimately uses, not just the UN and other international organizations. But this is what people, like don't know, and maybe you cannot blame them, but you can blame people for automatically doubting numbers just because of the identity of the source, and it's not even the source in and of itself. It's a Ministry of Health under a governance structure where Hamas is in charge. By contrast, and you can share more about this, the numbers that Israel has given us on a number of matters, let's set aside the other claims that have been made, are the ones that have actually been collected by the record, even by Israel itself after the fact. So if we can start with the issue of access, I would really appreciate it, because especially what you also said about the ethics of calling and asking, trying to find out, that would be a good start.
So if I can also answer about the validity of the Ministry of Health data. But in terms of access, or in terms of surveys, so currently today or in other conflicts, there are methods that we can do, and I'm actively currently trying to do some of them to try to understand what is the mortality in Gaza based on different lists, looking at social media, looking at different aspects. There are in other conflicts like Iraq and Syria and others that they've done household surveys, and they would call people and ask them how many members died and why did they die from. Now, it's always hard to get the exact cause of death, and there is PhDs being written about how do you define causes of death. But what I want to say is that it is possible to do these household surveys. And there's been discussions about this. But the problem is today is that, first of all, the communication inside Gaza to try to get information from people is very hard. We know that internet and telecommunication is not great. The other thing is that those we're able to access usually are in areas where there is less fighting. And so we get a biased sample usually. And in different wars, this is the same thing. The other element that also comes to my mind a lot, and because I've seen a survey now being trying to really understand what happened with maternal and newborn in Gaza, is that a lot of the comments come from people about the need for a vaccine, the need for food, the need for to go to a hospital to basically, because they had a C-section and they need to stitch their C-section again because of different reasons of infections. And so it's an ethical component where if you're asking these people questions about who died and how many people died, at the same time, you're not able to provide them with food or with milk for their children. And I know different UN agencies are doing a lot of work on the ground. It's just that without a permanent ceasefire and without a access of humanitarian aid, it's, I think, unethical today to start saying we want to know the exact number of people who died from chronic diseases. We could try from different ways, but I think we need to think about, if I call a person and they tell me I don't have my medication for type 1 diabetes and I don't have insulin, how do we respond to that? And I think that is another element that happens a lot in wars. And I know there has been efforts in terms of maternal and newborn, and hopefully we can try to get something out in the end of the month. But it's not a straightforward answer that people like to tell us, like how many people died from malnutrition. It's not an easy answer today, or how many people died because of cancer treatment that they're not able to get in Gaza. So what we try to do in the projection is say, okay, we know this is the situation. We know that this is how much water there is. We know that 500 people are sharing a toilet in different shelters. We know that breastfeeding is at this percentage. we know that acute malnutrition or children that are basically very thin are at that percentage. What is the projection of them having polio or them having cholera, which is the next, I think, like as a public health, is probably the next one that would probably show up in Gaza. And the fact that there has been 25 years of no polio at all in Gaza, and now we're seeing it, is 100% predictable. No, it's not to say that these are projections and we're not predicting. So I cannot really, I'm not, I cannot predict the future, but they're projecting what might happen. But asking different people and experts in infectious diseases, they could see this coming because of the situation of the water and sanitation in Gaza. And because of the big destruction that happened to the water sector. And people living in tents and in shelters and crowdiness. So all of these aspects, we put hypothetical scenarios. And the other thing we try to do in these projections is to say that we have three hypothetical scenarios. In February, we were still hoping for a permanent ceasefire. So we had a ceasefire scenario. We also had a scenario of a status quo in February, and we had a scenario of an escalation. So the attack in Gaza is becoming more and more, to try to see the wide range of what the diseases and how the diseases are going to be different. And one of the key points that we try to say to everyone is that because of the collapse of the healthcare system, this is not going to end tomorrow. If inshallah, a permanent ceasefire happens tomorrow, there would still be a threat of infectious diseases. There would still be a threat of people not being able to get access to operations for heart attacks because the doctors are not available anymore to do the surgeries, and or even facilities are not available. The fact that 2 days ago the head of the laboratory in the Ministry of Health in Gaza was killed by the Israeli army is another thing that it's worrisome, because these are the people who have the labs who are able to track infectious diseases. And this is why we're starting now to see polio, and we might start to see others. And so if we're not able to track this, it's gonna spread more and more. And this very sad reality in all of that is that it's we foresee all of this happening, and the threat of the indirect effect will be big, on top of the traumatic injuries. So I hope that was a very long answer to your question, but um, yeah.
Not at all. On the contrary, I mean, we are all thirsty for this sort of analysis and information because people take for granted when numbers are reported that these are numbers. And of course, during our first conversation, you and I, you taught me a good lesson when I said, concrete things is sometimes what people are looking for because this is a more concrete topic than others. You said no, 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 this is actually something over which there's a lot of debate and discussion. So I've learned to temper my confidence in the concreteness of things, even if we, as I said in the introduction, it's not a puzzle in terms of the magnitude, right? But beyond that, it is something that we need to learn more about. Zaina, can you talk more about how you approached mortality estimation from trauma during this war, using the Ministry of Health data, and how did capturing mortality evolve as the conflict progressed? What have been the challenges, the increasing challenges, not just in terms of the magnitude, but also in terms of uh, access, given that until today, I'm assuming, and depending on the moment, but we do know that the area is it's besieged, it's closed off, and only few kinds of people can enter. And even when they are internationally sanctioned, they are under pressure and often are killed and bombed by Israel, as we have seen with the various international groups. So if you can talk about this, like these two issues, I'd appreciate it.
Sure. So it's a nice segue also to talk about the politics of data. So people think that quantitative data sometimes is more it's a fact, it's a truth, and that has been a big debate, and has been the big debate in the Iraq War. If you go back to when Iraq War happened, and Bush also like went on about that the numbers are not correct and all of that. So so just to say that the politics and the numbers and how these numbers um, have always like are not hard facts, and that's also something that is important to point out, that people, and it's important to show methods, and and how things are come and why these numbers are correct. So this is where if I share, allow me to share my screen, is to show a bit at the beginning of the war, when the Ministry of Health released the listing of all those that were killed. And I know that most of people now are aware that these lists are valid, but at the beginning, people are still questioning these numbers. And so, what we did, in fact, was to see the age distribution of those that were killed, uh, and the listing that the Ministry of Health has released actually includes something called a national ID, which all Palestinians have. And this national ID is multiple digits. And we were able to actually look at these individuals and look at different records that show that these people were killed. If you look at social media, or if you look at um, other cross-checking. And actually, there's a good report that was done by Air Wars that used the first 3 weeks of the war, the list that the Ministry of Health has released, and they cross-check it with social media, and you could see that these the same names of people. The other thing is that we tried to do was actually to see the ages of people that were killed as terms of proportions, as a percentage, and then males and females. And I always like to refer to what Muhammad al-Kurt says, is because like everyone talks about the 60% women and children. And in fact, I think this is the concept of the perfect victim, that these are that they should be women and children and elderly. But what about men? And I always like to refer to this because people would look at the male of 30 to 40 and they assume different aspects of combatants and all of that. And it's not we should not be doing these assumptions, and the media has done a lot of that. And then at the beginning of the war, what we tried to do also is to show the mortality rate of males, this is in blue, and of females in red, as compared to the mortality rate in 2021. And as I was saying at the beginning, the Ministry of Health has very good mortality estimation before the war. So you could see at age basically 0, there's a very high mortality rate, and this is normal because kids tend to, like premature kids are more likely to die. And then the likelihood of people to die at age 20 to 24 is actually very low, and then it increases with age. What we're seeing is with the Gaza war and the war on Gaza um, is that at the mortality rates basically just increase. And children of, for example, age 0 are 3.7 times more likely to die. And what we did also was also look at mortality rates of UNRWA staff, which is like the hard line here. So we look at how many UNRWA staff were killed in October. This was still in October, and compared it to the Ministry of Health reporting. So basically two different sources. We also looked at the healthcare workers that were killed, and they were actually a bit higher than the population of Gaza that were killed. And you could see these two lines and how they would fall into the mortality rate. And we did other things in the paper if you want to look at on why these mortalities are actually on why these mortalities there is no reason to doubt that the Ministry of Health numbers. The other thing that I want to say is that if you look at the I mentioned that these lists are actually numbers, that names coming from hospitals. And these are the different hospitals that report to the Central Information System in Ashifa, and then it moved to Nasser. And what happened is, with the collapse of the system, with the attack on the hospitals, the number of hospitals that were providing names of people decreased. So especially this is in April, and where the fighting was happening more in the north and in Khan Yunis, the hospitals there were not able to report anymore the data and the numbers of people killed. Now, what happened again, and Ministry of Health has been talking about, okay, we have this much mortality, and this is coming from names identified from these three hospitals in the south, and the rest, what we know, is actually bodies. So we know there is 7 bodies at Shifa, and in Indonesian, for example, there would be like 10, 15, but these are not identifiable at that point. What happened actually is that the ministry in August and actually picked up the system and was able to provide data back again in Ashifa and Indonesian and Kamal Udwan. But what happened is that the Rafah incursion has led to Emirati and European and Nasser to stop reporting. And so you can see now what's the issue with the numbers is that when you attack the areas where people are reporting the numbers and where the highest fatalities are, this is where it becomes harder to report on these numbers and so on. And so, just to say that at the beginning of the war, all the names were identifiable. Now, what the ministry is able to identify is not all of the 40,000 that they're releasing. It's actually around 32,000. And the rest is they know that there are bodies and these people were killed. We just do not know their names at this point, or the ministry does not have their names at this point. And they're doing a lot of exercise to try to get these names. And so, and just to bring back that, three and five are actually women, children, and elderly, but also this is the media reporting it again about the fact that adult men also are included in these lists. And just to say that the Ministry of Health's attempt to try to get more number is to do surveys with people and to ask them to report. So this is in Arabic, but what this is saying is basically asking family members to report on whether a family member was killed or shaheed, martyr, or whether he is missing or she is missing, with the number of the ID, which I mentioned every Palestinian has a national ID, whether the child is a baby, because in fact, now that the babies do not have issued an ID, so the newborns would not have IDs, and information on those who were killed, and the link is actually longer, so if you want to check it out. So yeah, this was what I wanted to say in terms of the direct mortality and traumatic mortality.
Thanks, Zaina. And I wanted to bring everyone's attention who is watching now or later. Fortunately or unfortunately, a lot of people end up watching, I mean, by the thousands, these conversations after, because the time is not, appropriate sometimes. I am going to put on the screen right now the QR code, which includes the reports, some of the reports that we will be talking about, and that Zena has actually worked on. So feel free as we go through these topics to scan it with your phone. If you're watching on your phone, I don't know what to tell you, but if you're watching somewhere else, you can scan it, and we'll also make all of the uh, data available, including the reports, including the articles that Zaina has either written or co-written, available on the Jadaliya post once this conversation is over. Zaina, let me go to the topic of indirect health effects and projections. First of all, I am one of the people who is ignorant about exactly what indirect means. I know that it doesn't mean that somebody was shot directly. It means something else. If you can explain to us that vast category of indirect, that would be great. And also, if you can explain the scenario-based projections that you developed for excess deaths in Gaza, which we talked about, and they're included in what the announcement for this event addressed, and how you'd approach the projections for different health areas that are also in the body of the announcement, including infectious diseases, nutrition, non-communicable diseases, maternal and newborn health. And then if you can close with the, your key or find your findings regarding indirect health impacts of the war. But if you can please start with just educating us on what is indirect. Uh, what does it mean when somebody says indirect health effects and projections or indirect deaths?
Okay. If I'm allowed to also share again my screen, because I did actually a slide about this. um, and just to say that a bit like the direct effect of the war or the trauma effects is like we have aerial bombardment, we have all of the injuries that people are going to the hospital. Just to say that everything I was talking about also before does not include people who are under the rubble and who didn't go to the hospital in terms of listing. So all of that goes into the direct effect of the war. And this would lead to basically what sadly in epidemiology we call excess death. That means basically over and above what would be expected in a year. And then the other aspect is the indirect effect. So what I mentioned in terms of like poor shelters. So overcrowding, people are using 500 people are using the same toilet. There's only 3 liters of per person per day, which the minimum is actually 15 liters per person per day of water needed. So basically the poor shelter, the insufficient water and sanitation, so the very bad situation, the disruption of the healthcare system. So whether it's an attack, inability to access, no supplies. So there is you go to the hospital, you need insulin, you do not find insulin. You go to healthcare centers, you ask for medication. All of that, the disruption of the vaccine cold chain availability of vaccine, and finally the insufficient food, so the malnutrition that we're seeing, all of that leads to excess mortality from the indirect effect. That does not mean that also does not lead to increased morbidity. So this is also a very epidemiological term, which actually means that diseases that basically you'll have more likely to be acutely malnourished, to more likely to have worse disease outcomes. But what we try to do is just to project mortality from all of these conditions. But at the same time, we know that malnutrition, if it did not lead to death, has also a long-term effect. Polio, if it did not lead to death, has a long-term effect of basically paralysis. And so we only projected the very end of it, which is the mortality. And so this is the indirect effect. And this is why we projected these, but then we looked at scenarios where an epidemic happens. So where polio is introduced, or cholera is introduced, or measles, basically outbreak happens. And all of those are called epidemics. And this is also where where we it's not the same as having an influenza, which is always available in a community where, in fact, polio did not exist in Gaza for 25 years. Sorry, I'm repeating a lot about polio. It's just that it is what's happening now, and it's very sad to see. So just to say that the traumatic death is what we talked about, is the immediate death, the infection, whether it's endemics, whether it's influenza or rotavirus, on all of these, and these airborne or oral fecal transmission. And then you have also the epidemics. This goes a lot into infectious disease words, so I will not go in details, and then there is also the other effect on maternal and newborn. So we know that the traumatic death of a mom is also maternal, but it's also possible that a woman who actually has a risky pregnancy, who needs hemoglobin and would need a lot of blood actually, is not able to access hospital and is delivering at home or in a shelter. without access to a doctor. So usually a husband is delivering her or other people in the community. And if she needs life-saving intervention, so hemoglobin, blood supply, for example, uh, or even treatments for sepsis, this is all needs access to hospitals. And if they don't have it, this would lead to excess mortality for these women. And these have been actually in Gaza before the war. The numbers of maternal and newborn death were actually very, very low because they had a very good healthcare system. What's happening with the war is that because you're not able to put a baby in a NICU when they need access to a NICU because there is no electricity, this is where basically you have an increased mortality, that this baby could have been saved but is not saved. And finally, the chronic diseases. And I'm going to talk about chronic kidney diseases because they were the most urgent one at the beginning. So they need dialysis. If they missed a dialysis, the more they miss dialysis, the more their likelihood of mortality increases. Same thing with like also diabetic patients. So diabetic type 1 are reliant on insulin supply. It's not like they can go without insulin. So if you're diabetic type 1 and you don't have access to insulin, after a certain point, your mortality increases, the mortality from the indirect effect. So it's not that they're dying from a bombing, but then they're dying because they don't have access to insulin. And that's also all related to the war. So all are war-related mortality. We did not look at chronic obstetric pulmonary diseases and other diseases because some of these models were actually done for the first time in this war. We're trying to really show what's the impact of the war. But of course, if you don't have access to oxygen, and Israel has at that point in February did not allow any oxygen to go in. People needed oxygen when they had the chronic obstetric pulmonary diseases to breathe. And so if they don't have access to these patients, quite a lot of them actually died, and there's been some reports of that. So I'm not gonna go in a lot of the details about all of this. You can go and see it in the report. But what I will say is that we have like a 50-page report with 70-page, I think, methods. But what we try to show is that from these different diseases, what would be the mortality? And based on a ceasefire, based on the status quo, so the situation would stay the same from February till August, or based on an escalation. And the escalation was the incursion of Rafah, so the Rafah attack. Now, the traumatic injury, and we were trying to just project based on what happened at the beginning of the war, what would then be the traumatic injury. But that also depends on how the war happened and what was the scenario. The other ones that are important to look at is actually also the infectious disease one, the maternal newborn death, and the non-communicable diseases, because these are actually the ones that people are not documenting. And what we say is that from February till August, visualizing Palestine with Jewish Voices for Peace work together on this visual to try to show our results, not in a very because we always show tables and they wanted to visualize it. And what I think it does really well is show that at the beginning of the war, and at that point, and there were around like 30,000 who were killed, and the people under the rubble was 10,000. So they added this up with 10,000 of people under the rubble. And then what they included is that if a ceasefire happens during that point, that we would still be at a 51,000 excess death. Whereas if the genocide continues in the same way, it's from and with the different diseases, what could be or what the projection would be of the mortality in August from the different diseases, not only the traumatic ones. Now, just to say that they also like looked at how many lives could be saved if we did a ceasefire in February. But this is the argument could stand also today and tomorrow and every day about saving lives with a ceasefire. But also there's a concept of even with a ceasefire, excess mortality from diseases will be higher than it was before the war. And then I'm not going to go in the epidemic and endemic and all of this, just to say that this slide is from February, and what we were trying to say is that the probability of an epidemic with more than 100 deaths, so whether people would die from polio, if the situation stays the same and we were raising the alarm, would be very high from polio, from measles, from cholera, from meningitis. And it could reach, if a cholera outbreak happens, to 120,000. So today there is a vaccination campaign that the Ministry of Health in Gaza is doing with collaboration with the WHO um, and with the WHO and UNRWA, the UN agency that works with Palestinian refugees. And basically they're giving the current outbreak is happening because of a polio vaccine derived variant, and this one here. And I'm repeating the point of polio because it's very sad to see this happening today in a region where we have eradicated this. But I could see that the next argument is going to be probably cholera or measles. And it's worth thinking, like, people who worked in Syria and people who worked in other contexts would tell you that we saw the same in Syria and others. And this becomes even worse when the acute malnutrition increases. So I'm not going to show the numbers of acute malnutrition. What I will say is that before the war, and I am a nutritionist as a base practice, wasting, so very thin baby children, were around 1% in Gaza. Okay, we were not even talking about wasting. We were talking about possibilities of overweight and obese children. What happened is with the war is that the current numbers that are coming from different places and different clusters puts it around 10 to 15 to 20%. So they are depending on the regions and all of that. So that means it's like around a 15-time increase in acute malnutrition. And it's all based on the fact that food is not being allowed to go in and has been heavily restricted, and food assistance. And so food and children that are acutely malnourished and get polio or get cholera are more likely to die. So whereas if you have a good nutrition and you get any of these infections, you're more likely to be able to combat them. And to talk about the other aspect is the maternal and newborn, is to say that the numbers, and if you look at the terms of numbers from maternal deaths, so basically women who went to the hospital, who was not able to go to the hospital to deliver, to get the care she needs, we projected around 40,000 in an escalation scenario. So in purple, it's the escalation. In green, it's the ceasefire. And in gray, it was what would have happened if a war did not happen. And although the number is, if you could say, it's a bit small, so 60 women or maternal death would happen, it's actually numbers that we've seen 10 to 20 years ago in Gaza. So it's because of the complete deterioration and complete collapse of the healthcare system. The same thing for newborn and stillbirth. Stillbirth is when a baby is born dead. It also happens that because of the war, because of the terror and all of that. I have to share a few things in terms of neonatal. I've been looking at recent data, and a lot of the babies actually die from dust inhalation, because after the attack on a hospital, they inhale dust and basically they're dying. And these deaths are completely like not documented in traumatic death, but also part of the mortality and due to the war. Finally, I'll talk about non-communicable diseases. And why do I talk about them too much? Also, sometimes is because I think there's a lot of focus on moms and babies, and we tend to forget that in Gaza before the war, the biggest threat in terms of public health was actually chronic diseases. So people who had cancer, people who had basically high cholesterol, people who had type 2 diabetes, people who had hypertension. And there's been quite a bit of documenting of that. If you're interested, I'm happy to share before the war. And what happened with the disruption of the services you could see excess mortality comes from people having a heart attack, basically, and not able to get treatment for it. People not getting treatment for strokes, for not getting dialysis, and also not getting cancer or chemotherapy treatments. And so in this what you see is what happened in 6 months would have happened. So mortality would usually happen a lot in these groups in terms of cancer, in terms of ischemic heart disease and gray. And on top of it is the scenarios. So in a ceasefire, in status quo, and an escalation. And I think they tend to be forgotten because they tend to be the adult population and in terms of ischemic heart disease. But that is a, a major push for field hospitals, for basically getting back the healthcare system of Gaza. So getting different hospitals back to be able to do these operations. And that's it from my side. I think in terms of the projections, I have talked quite a lot, but it's basically, as a recap to it all, is that with a ceasefire, we will still see mortality from all of this. And sadly, we're at a stage where we saw the escalation and things are still moving forward with that.
Thank you, Zaina. There's there's a lot to talk about, and I know you said something about showing figures from the pre-war, pre-genocide moment. Did you want to do that, or we do?
Um,
Well, you want to take your time? We can come back to it whenever you feel comfortable. Um, Is there anything else you'd like to share with us on in terms of methodological approaches in these types of active conflicts, and maybe you can tell us if there's something that you'd like to tell us on this question and on the idea of what happens after the war in the cases of Syria and Iraq, and it's very interesting. Like all of these things are happening in the west in Western Asia, this like a smallish area, with the exception of Libya and Sudan. Yemen, Iraq, Syria, Palestine. It's makes one wonder. However, what happens after things subside, because there's always ongoing hostilities, skirmishes, and so on, and how is that different, and is it simply the question of access, or is it also in a question of records? For instance, more than 70% of buildings in Gaza have been destroyed. Some people say even more, which is another statistical matter to address. uh, so many of the records are gone. And we do know that some of the records, or quite a bit of the records, in terms of where people live exactly in what apartments and so on, which is how the Israelis are able to pinpoint certain buildings and certain apartments, not only in Gaza, but also apparently in Beirut. Different story here. Uh, those records are in Israel, all right? A lot of them. What happens with that issue in Gaza even after the war? Does the absence of these records make it difficult to count? And I'm gonna get to the questions by the audience, but I would like to ask people to add the word question before you actually ask the question. We do have one such item which has been added even before I said that. We will start with that after you share with us your thoughts on methodology and what happens after a war or after a war subsides, and then I'll ask others from the audience to the extent that we have time.
yeah, sure. So in terms of methods, that this is now the big question that people are coming and saying these are projections, but also you need then to have accurate methods to assess this. And I do strongly say that, of course, we need to document. And I think documenting is a way to show what happened, but also keep track and raise voices about how the system happened. And I'm not saying that household surveys or calls or phone calls or try to get these information is not important. And this has been done in Iraq and less so in Syria because of the whole controversy. Has been done more in specific areas in Syria, not the whole country of Syria. But just to say that household surveys are the way to go forward to try to understand the indirect effect of the war, or even things like what the Ministry of Health is doing in terms of filling in a survey by the people themselves about the traumatic injury. What I raised at the beginning is the issue of today to come and design these studies. We people are thinking and trying and doing, but it's also about thinking about the ethics of it and how are we going to provide these people the care they need. The other aspect would be also the selection bias. So, are we only talking to the people that are better off? So, people who are able to go to hospitals, whereas people who are actually home or at a certain point in Shamal, like it was very hard to get communication. And so, are we having a selection bias? Like, are we only getting one part of the story? Or even are we talking to only the people who are the most able to get access to phones and to have good internet and all of that? So I just want to say that uh, who are we talking to and what's the selection happening? And this all questions need to come up when it comes to this, but also came in Yemen and it also comes in other conflicts. And so that's why I say these numbers are not the easiest. Finally, there is efforts to try to do things called capture recapture, which basically is that you use listings. So the list of the Ministry of Health, the list of the survey, different aspects, link them up and try to find what is the overlap and what didn't overlap. And these methods are also available. Some demographic methods have also been done. So I'm not going to go in a lot more details in all of that. The other question that you asked, which I probably forgot, was about the other than methods. I don't remember.
What happens after?
After, yes. So
I
yeah,
mean,
like that.
we're in September 2011. We could not fathom that in 2024 the televised genocide and murdering and killing and raping and destruction would continue for 11 months, and now we're close to a year. Every single day, every hour, there are thousands and thousands and thousands and thousands of images that we are, seeing. uh, we did not, anticipate this. And one says the word after, while you have your one's hand on their heart. But yeah, after.
So that also, I'm not gonna go political, but I
No,
think there is the
you don't have
question of
to.
no, 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 I can, but I'm saying like who is gonna be working in Gaza? And for me,
Oh,
I
I
have a
see.
very clear answer. Like the Ministry of Health and the Palestinians, who will, and the other aspect I think in the after when it comes to this humanitarianism is what we saw also in other conflicts is basically the different NGOs and the different humanitarian actors and the different UNICEF come in and it becomes how to say like it's been very well documented by a lot of people about what happened in Syria, the fragmentation that happens, and in Lebanon actually, because then you get NGOs trying to get to do different things and then people get um, some areas get covered but other areas of care do not end up covered because there is no funding and different aspects. So this issue of the day after or what happens, I think for me partly is to say that is UNRWA still going to be there for healthcare, and is the Palestinian Ministry of Health still like it's all about that aspect and even to be honest the how everyone starts to come and not have a centralized system of the healthcare system anymore. And we've seen that. We've seen that in different conflicts, and I hope it doesn't happen in Gaza again. But yeah, that I don't know if that answers your question, but just to say, for me, I always think of the day after in terms of healthcare, in terms of documenting and all of that. I do think that people will document, and I do think mortality will be studied better and will be there will be better surveys to document it. I'm 100% sure that MSF, or I'm not saying them, Médecins Sans Frontières, or other agencies who have historically done that in other conflicts might also do that now. So, yeah.
Thank you. I have a ton of questions, but I guess we can also speak another time separately. Let's start with a question by, and I have to say, besides thanking you, Zaina, I have to say that this is one of the few times that I actually deliver on my promise to field questions from the audience. So at least it can be said that sometimes I do that. A question by a viewer, Aparna Gopalan. If people don't want me to say their name, they can just add it to the question, even though it's public. To what extent is the 40,000 number an accurate reflection of even the direct deaths by violence, given the bodies under the rubble and breakdown of hospital reporting?
Yes, I would suspect it's a very high, but there is still missing, and missing those are under the rubble and all of that. And I hope by the end of this month or next month, I would have actually, I'm currently conducting an analysis on this to show how much it's an underestimate. And I will share this with you and your audiences but I'm trying to get this out by the end of this month.
Yes, if you don't mind, we can add it to the Jadaliya post, which will be on Jadaliya. It's already on Jadaliya. People can go on Jadaliya right now and see on the first page this event. This is the same post that will end up including the whole video, the whole conversation, as well as all of the material that we have used now and the ones that you'll send me. So that would be actually remarkable if you can do that. Let me go to another question. Lots of, okay. There's a question of somebody who wants to connect with you because
Send me an email.
they have developed mechanistic models for updated projections. I will try to figure out a way to connect with them. You could send an email to info at jadaliya.com, JADALIYYA. It's not Jadalia, please. Jadaliya. Anyway, next question by Nazim. The UN stats say that Gaza has 500K who are in famine, um, phase 5, and 800K are in phase 4. Phase 5 states at least two
Yeah,
people
I know
die
his
of
question.
starvation a day. Is there any way to track these indirect deaths?
Yes, okay. So Nazim, this is the question about the IPC projection. At that point in phase 5 so to come up, okay. To come up with the IPC classification, it's based on different indicators. One of them is food insecurity, so access to food and the quality of food they have access to. The other one is acute malnutrition, and the third one is about indirect effect of the war, whether there would be this aspect of two people die and all of that aspect. To come up with this phase classification. Now, because they did not have the indirect effect, but they had very good indicators from the people using coping strategies of eating herbs, and because like basically also eating like food for livestock, and because there was documentation of the food insecurity, and because we've seen in the north of Gaza numbers of acute malnutrition reaching 30%, this is why they put in that the projection could lead to 500,000 of famine in phase 5 and would be two people die of starvation, like that aspect. The thing is, how well that translates in Gaza is not very clear. Partly is because that people before the war had very high vaccination rates. So they were really protected. And this number comes from other contexts where people had less access to vaccines. And so people are trying to understand that, but I do not, I cannot answer 100% if that translates into this two people die per day, and mainly children. But yeah, that's not at all clear, and even the IPC would say that. And they actually say that it's not been documented that that's the case, if you read the IPC report in detail.
As we talk further, thank you. As we talk, I was on mute. As we talk further and field other potential questions that are questions, not statements and declarations, and critiques. Critiques are very welcome. I mean, it's wonderful to hear people who are, thoughtful about critiques, because sometimes it's really not that productive. Um, there's a question by Hatim, and a question by okay. Hatim says, the work you do is so valuable at face value. I wonder, however, to what extent it has been in the past, in similar studies, be used in a court of law, thinking about the ICJ, the ICC, and Shukran. I mean,
Have one.
they are saying this. I'm not saying that.
Oh,
I mean,
no, have one. But I want to say that actually because the mortality validation at the beginning of the war, when actually Biden said that he does not believe the numbers and the ministry released the numbers, as an epidemiologist, and because I knew really well the situation in Gaza, I analyzed it very quickly and I made sure that it reaches, and we published it, but we also made sure it reaches different people, and it was used as at the beginning with the South African application to say that the numbers are valid. So this has been used as a citation, but it has been used to make the arguments that the numbers are correct. And the other aspect of the projections is that we have used them when we've actually had a lot of conversation with both the ICJ and the IPC. So the people who do the IPC, which talks about the famine aspect, we've basically fed a lot of the information and all of that to these bodies. And so just to say that I think we were trying to make a huge push at the beginning to say that that this is what we know, that polio will happen. You know that the numbers are correct. It's not that in 3 years we're going to come and say, oh, by the way, the numbers were correct. And so if you have other ways also, we can make sure that these numbers reach whoever needs to use these numbers. Please let me know. But I know that for example, the Human Rights Watch and others have picked up the reports and have reached out to us in different ways. But yeah, I'm happy to send details if people need, especially if it comes to that. The other aspect, I don't know how much we delved into that, is that the malnutrition situation has been also talked about in Israel, actually, by and the projection and all of that, and trying to basically make sure that aid goes into Gaza because of the malnutrition and the courts in Israel. But that's like a different story.
thanks, Zena. I have a well. There's another question before I get to mine. And whenever you feel, Zena, that we are abusing your time, just send me a text. It doesn't even have to be polite, and say that you got to bounce. But thank you, and we all appreciate your time. A question: 500 trucks of aid were delivered per day before the current siege. Now going on 3 months at only 75 trucks a day since the closure of the Rafah border, the complete closure, I should say. How quickly do you assume massive deaths from starvation will happen in Gaza?
Yeah, that is also the question that people ask in terms of acute malnutrition projections. And we have done a model in the report, then the website that you'll see, but we also updated that model that we did not yet publish. But it's actually based on what Nazim is saying, is like how much calories is going into Gaza, how much parents are saving from their food intake to feed their kids, because this is what happens also in terms of a coping strategy. So parents don't eat or they reduce their food intake so their kids eat. And then based on all of this information, we looked at projections of what would happen in terms of food. So in terms of mortality, that's a bit harder to pinpoint, but I'm very happy to have a very specific discussion about this if you want to email me. But in terms of acute malnutrition, if the situation stays the same and all of that, we projected that it would reach to 15%, and it has reached. In the next few months, if it stays the same with all of that, it could reach to 20 to 30% and so on. So at a certain point, it's going to become very, very problematic. We also included this very minimal food that came from airdrops and from the seaport that opened for a few weeks and then closed. But we also tracked how much calories came from different sources. And I just want to say that the number that you're referring to by the 75 trucks a day is only the UN, the WFP or UNRWA number. There is also commercial food that's coming in that's also not tracked anymore. So it used to be tracked, but with the Rafah incursion and the Rafah attack by the Israelis, it stopped being recorded. And now the recording only comes from Kogat, which are the Israeli sources. And they say that the number is fine, which we all know that no, it's just when you stop basically the independent reporting from UN agencies, that was a UN agency system, has stopped completely from being able to report commercial food being going in. So it's a bit higher than 75 trucks, just to be, if you want to be precise about that.
Um, I would like to go to a couple of the websites where there are articles by you and others that you've sent me. Is that okay? So we can just like address them, and also we'll be sharing them. I would like to do this real quick. Give me 1 second. It's not. It's giving me a hard time, but we're going to do it. لحظة.
Can I also say, because someone said that I agree with them that it's going to be bad and looking at Yemen and others, but I think it's also important to think that Yemen has a very high cholera, that Sudan has cholera outbreaks, that the situation in these countries before the war was very much worse, and Gaza is getting there. But also, like so a lot of people compare to different wars, but Gaza was, in terms of baseline, in terms of infectious disease, because you're gonna die from malnutrition and infectious diseases and the combination of all of that, and it's a bit different than Sudan and Yemen. So it would be resemble something similar to Syria, to be honest. What happened in Tulkarem refugee camp and some of the others. So it would look more like Syria.
That's not good. All right.
That's not good. No, no, there's nothing good about any of this.
I know. I know. I guess I've those of us who have had مش عم في يحكي. I cannot even talk. Those of us who witnessed the Iran-Iraq war in the 1980s, let alone I witnessed the Lebanese civil war in the 70s, and then the Iran-Iraq war in the 80s, which is the first Gulf War. But in America, they don't count it. They count the 1991 as the first Gulf War, and then the 1991 war on Iraq, and then of course all sorts of smaller conflicts, and then of course the 2003 war, the 2006 war, and then every single incursion, invasion, and destruction of Gaza from 2008, 9, 2012, 2014, 2021, and now this genocide. It's a bit much. And I that's why I'm saying it's like it's those of us who have been around and watching these things. I mean, I'm not saying we are desensitized, but it's
Yeah.
I'm not even sure what the compounding effect is. All right, let me go to the website. This is from what I understand, this is the crisis in Gaza scenario-based health impact projections, where people can download report 1 and report 2. As I shared with you, you could actually watch this video again, and I will leave at the end the QR code for quite some time, so people can actually scan it and go to the information. We have already put everything on a Google Doc, so everything you're seeing right now is going to be on a Google Doc that I will also use to put all the other information, even if you don't go to Jadaliya. So you'll have that. So Zaina, this is what you had sent me, and this is the downloaded report 1, crisis in Gaza scenario-based health impact projections, and this is from 7 February to 6 August. Do you want to tell us about a couple words about this before I go to the next one?
No. Basically, this is the detailed report that basically, if you go down a bit, has a few page of content, bit down, more. Okay, like theme by theme projections, and this just has the results. And there's another report that has the methods. So you'll find more detailed methods. It's a long report. We did try to then show different in different places an abbreviated version. We have an executive summary, but still, it's not.
Oh,
In retrospect, I think we should have done it less condensed. Let's maybe, yeah,
more condensed or less condensed?
less.
Less طيب. So this is the second one, projected deaths due to traumatic injuries in the Rafah governorate.
This one we don't. This one we have done, but quickly because there was an ask about what would happen if Rafah happens. I didn't talk about it much because then it ended up the situation became a bit different in on the ground. So the other one is more the indirect effect of the war.
Okay. How about Zaina, if I send you the link and designate you as editor, and feel free to take out or add whatever you'd like. I'm asking you to do more work, but this way we could have on that sheet things that people might want to have, and this is one of the reasons we are really excited and honored that you're with us today, because this is one of the teachings that I know includes so many resources that people end up wanting to access. This is the Lancet, excess mortality in Gaza, October 7th, 26th, 2023. Do you want to say anything about this
No, this is the first one we did
that you showed me
with the,
today? Okay.
yeah,
All
yeah,
right. And this is finally the pregnant woman in Gaza. And these are pieces that you've written, right?
yeah, yeah,
And
yes.
with others. Okay.
No,
So
that's it, yes, of course.
excellent. Okay, so let's go back to our main page. Um, now, before we get to other questions, and I won't keep you much longer, so I want to ask you something that is, very basic, right? So we're sitting in a living room, group of people who are interested in the human condition, and somebody's asking, what is what's going on in Gaza in terms of ballpark deaths. People are just asking, and throwing out numbers. Or if you're in a classroom and you're trying to say, since October 2023, the number of people killed, we know how many were killed on October 7th. Actually, we know very well, right? So if somebody asks how many people have been killed uh, without considering the people under the rubble, even though these are in the thousands, I mean, what do we say? I mean, do we ask them to watch this video, or are we able to say something? I know,
I want
now we say
no,
forty
no,
thousand. Yeah.
no. The one thing I always say, it's going to be 100% more than 40,000. There is from the trauma, but also the non-trauma. The non-trauma ones, the projections that we have are give you an estimation of how much more it could be, but it also it could be more. And and the projection we had in the escalation was 120,000, but I would not use these numbers and say this is how much mortality there is today in Gaza, but it is probably much more than 40,000, possibly reaching 120,000 and so on, all of that. And that would be like as a quick answer, maybe. I would also say something that today, if it's 40,000 or it's 50,000 or it's 30,000, the whole war on the numbers and how much it is, it became a bit like we make a fuss about it when it reached 40,000 in the news. And then we'll make a fuss again when it reaches 50,000 in the news. And I think we have become desensitized to this number. And we've seen the stories of the twins who were killed or different children that were killed. And the numbers became like, we're questioning, like, is it 50,000, 80,000? And at that point, it's a huge percentage of the Palestinian population in Gaza that was killed. And so that brings me a bit to my frustration with people who always ask these questions, and media specifically. It's like, can we believe these numbers? Or how much is it really? Is it 40? Is it 50? Is it 80? Is because then it becomes like we became so desensitized to that number. Like tomorrow, if I tell you that the number is actually 500,000, I think that sadly, the reality is that pictures and babies dying and mothers and all of that, it's just horrific, and it's a genocide, or what, depending on how you want to define. But I think it's a genocide, and yeah. So that's why that my answer is not quick. It's more like it's more than 40,000, but does it today? It matters. Of course it matters, but how much it matters? Is it to have that exact number?
No, but I mean there are safe ways to say certain numbers
Yeah,
or ballpark. Yeah. The other questions that I mean it's like from here and there in different platforms. I'm even getting like personal messages. I don't know how I'm getting some of those. I don't even know some of the numbers. But so another like question which I actually support, as in like I'd like to ask. So when Lancet addressed the number 186,000, can you tell us what that number is and how we should view it?
yeah, sure. So what they ended up doing is that they took the number of mortality from Gaza, and they looked at a review that was done on an old one that looked at mortalities from different wars, and they multiplied by a factor of 4 the mortality in Gaza. And actually, I think it was a bit misunderstood, because what they meant is that it could reach 180,000, but people understood it as it is 180,000. And even if you talk to the authors, they would tell you that. And they have even said that in different pieces. One of them was in New York Times and others. And I think they tried to give like an idea of what would happen based on Iraq and based on Sudan and based on other places. But what I will be a bit more careful about is to say that Iraq 1991 is a different reality than 2020 when it comes to 2024, when it comes to infectious diseases, when it comes to vaccines, when it comes to what we know about medicine. And so things have changed a lot. And so just to say that they've used these numbers based on very old studies, but it is an idea of what could be in terms of mortality. I would be a bit more careful about that. And I think they were a bit misunderstood. And even when you talk to them, they would also tell you the same. This was just like using a factor of 4. But another thing that I want to say is that people cannot do that for today for Sudan, cannot do that for Yemen, cannot do that for Syria. Syria's numbers are all over the, like, there's not one specific number. And so, yeah, it's not like, okay, I take this much people died in Sudan, and I'm going to multiply it by this factor and say this is how many people are going to die. Because as I tried to show, is like people die from neonatal reasons, people die from chronic diseases, and Iraq, 1991, was very different in terms of diseases pattern that you'd see today in Gaza 2024, or even in Iraq in 2024. And the healthcare system and the way we treat diseases and we vaccinate people is different. And so that's why I want to say that to be a bit careful in how do we interpret these numbers.
Um, Thank you, Zaina. A very quick question from Martin. Did any British mainstream media organizations show any interest in your reports on Gaza?
Yeah, we did report it on BBC and others. I have to say that this has been funded by the if you look at by British or organizations, but also like because it so it has been reported in the media, yes. But the thing is, it makes like a big fuss. People talk about it for 2 days, and then we go back to the reality on the ground, and that's what's a bit frustrating as because all of it is we could see this going to happen, and the predictable like I can project that cholera will this is gonna be the reality in few months, and this is why I bring up polio a lot, because when I saw that they found polio traces, and then after that we saw the first case and the first child that was paralyzed and two other suspected cases, that it was we knew that this was going to happen. So that's yeah, that's what I want to say at the end, is that hopefully we get a ceasefire today, but until then, yeah, I cannot hear you.
I put on the screen the email that people can send information if you'd like to connect with Zaina or anyone who spoke. We will make sure that we get permission and connect you with them, or give them your email so they can decide whether and when to respond. That's SC for steering committee at palestineincontext.org, SC at palestineincontext.org. You can email that. You can also email info@jadariya.com, but that email, info@jadariya.com, maybe I shouldn't have given it out, only because we get hundreds. I mean, we just get, it's a 14-year old organization, so we end up getting tons of stuff. But at SC at palestineincontext.org, we're definitely going to respond. Before I close with Zaina, if you can just give me a minute, Zaina, I'd like to share that this past week, speaking of media, we had two events. This past week on Tuesday, we spoke with Sana Saeed on understanding U.S. news media's complicity in Israel's genocide. It was a fantastic conversation, just like this one, on the media, by somebody who actually has been a mover and shaker in the media world for more than 10 years. I urge you to take a look also at where you're watching right now. If you go to the menu item live, if you're on YouTube, on Jadaliya's YouTube channel, or on the Jadaliya Twitter or X account, you can find all of these, and ultimately you can find all of them at palestineincontext.org. And the day before, or yesterday actually, we had a very important conversation with Emaya Gelman on resisting the ratcheting up of repression in academia and on campus in the United States, but this also can apply in many ways to the UK and beyond, potentially Germany, which is a very special case, of course. Because with there are difference in terms of the laws and regulations and the specific injunctions, but the overall atmosphere is similar, even if it's more intense in the US. And this conversation addressed the drivers of these targeting campaigns, the infrastructure of organizations that actually carry out these campaigns, and their connections to various right-wing and ultra right-wing organizations in the United States. So feel free to take a look at those. We'll also be back with you next week So long as the situation in Gaza is what it is, we will join you. And unfortunately, we will also be addressing the West Bank, which is very interesting because somebody in the comments, in response to somebody else in the comments, who actually highlighted Hamas as, if Hamas could just go away, they said that what's happening in the West Bank now and what happened before and what happened in Palestine in general before Hamas was even in existence has nothing to do with Hamas. It's not about Hamas, it's about Palestine, as a famous author one time wrote. So, so we will also be speaking about the West Bank, which is why we titled this series Palestine in Context.org, or the URL, because it's going to involve all of Palestine. Sorry, Zaina, for having you endure these notes. I was waiting for if there are any other questions, but we are actually out of time. We kept you for 90 minutes. We're very appreciative of your generosity and, most importantly, your analysis and clarification of things that one thinks they know. I learned so much from just hearing you, and I would like to go back to all of the material you shared. Do you have any closing words?
No, thank you so much. And the whole jadaliya on the numbers and the whole aspect, I think being precise and being putting real methods is what's going to help us show the reality on the ground. And I will emphasize this always, that we need to be transparent. We need to always talk about numbers that we can defend, because people are going to attack and we have to be able to defend what we're talking about. And so thank you so much for everything, and thank you for inviting me. I hope people uh, well, it was interesting for the listeners, and if anyone wants to email me, I'm happy to share my email. Thank you so much.
Thank you very much, Zaina. Thanks to everyone who joined. Thanks to all of the co-organizers and everyone who's been listening. And we will now give you a break for quite some time, Zaina. But I think we're gonna call you back.
Okay, well, let's see.
Inshallah. طيب.
Yes,
The best invention in human history, inshallah. طيب.
inshallah.
All right. Take care. Thank you,
Yes,
Zaina.
bye
Salam. Salam.
bye. Bye bye.